Dear student, today we are going to study our subject pharmacy practice, that is BP 703, hospital and pharmaceutical services. We have completed in our previous classes classification of hospital, types of hospital, organization of hospital, what is hospital pharmacy, functions of hospital, classification of hospital pharmacy, and organization of hospital pharmacy. In day before yesterday class, we completed location and layout of hospital pharmacy. Now we are going to study pharmaceutical services in a hospital. This organization chart of hospital we studied in previous classes, and now we are going to see the pharmaceutical services. Before that, now next is medical staff. Medical staff working in a hospital generally are not considered as a hospital staff or department, not a hospital employee for the private practice, self-employed. They may be faculty members, also some employed by the hospital such as infection control officer. They also belongs to HMO, health and health department, health ministry. They have a chief of staff governed by the executive committee of the medical staff. The executive committee have some subcommittees of PTC, QAC, accreditation committee, etc. These are the earlier I told you PTC, pharmaceutical therapeutic committee, that that is made up for the well running or good running of the any hospital. Medical staff is a part of PTC or must be part of PTC. Now the mission and the purpose of Department of Pharmaceutical Services. Pharmaceutical services which is running in a hospital. The mission and purpose of the Department of Pharmaceutical Services in a hospital given here. The providing and managing all aspect of drug use or drug distribution. The product and clinical pharmaceutical services, they take care of both product services or supply of medicine, drugs, surgical instruments, glasswares, and some fumigating agent or some disinfectant also. And they are also involved in a clinical pharmaceutical services. Next. To provide optimal drug therapy for the patient and to ensure the higher quality and most cost effective care. That is a important work of pharmacists. They also involve in a teaching and research activities. some teaching program going on, or throughout a year some teachings or training programs is going on for the budding pharmacist or some nursing staff or some medical staff. In that also some senior pharmacists, they will give or teach some information regarding the pharmacy department of pharmaceutical services. Annual goals should be developed to achieve the mission. The goal often include the expansion of clinical pharmacy services to improve the drug therapy. That is the main goal of pharmacists or pharmaceutical services. Organizational structure of the Department of Pharmaceutical Services. This structure also you note down in your notebook. If you have pen and paper, please note down. Director of Pharmaceutical Services, responsible for the pharmaceutical services delivered in the institution, include department, staff, faculty members, and other healthcare professionals such as nurses. In the absence of pharmacists, the responsible for the developing of policies and procedure, responsible for the implementation of practice standard, manage the services that includes for the preparation of drug and the provision of clinical services, teaching and research. These are the responsibility or services provided by the pharmaceutical director of pharmaceutical services. Uh, and he is looking all those things given here. Uh, he is belongs to our pharmacist community, and senior most pharmacists are appointed as director of pharmaceutical services. Sometimes medical staff they can appoint, but majority of cases senior pharmacist holding this post, director of pharmaceutical services. Now, organization structure of department of pharmaceutical services. This is pharmacy manager, director of pharmaceutical services. After that, pharmacy managers will come. The size and the nature of departments management depends on the number of personals and the scope of services. Represent the second level of management, and third level of management is supervisor. First is director of pharmaceutical services, second is this pharmacy manager, and third is supervisor. These three level of managers available as per the requirement of pharmaceutical department or particular hospital. As the if they need only one person, they will appoint the director of pharmaceutical services. If department is big, hospital is more than 500 bedded, after that they will appoint some pharmacy managers to regulate the things pharmaceutical services and report to the director of pharmaceutical services. Uh, we are talking about the pharmaceutical services within a hospital. हॉस्पिटल के अंदर फार्मास्यूटिकल सर्विसेज कैसे रन होती हैं, कौन देखता है, ये हम पढ़ रहे हैं. इसमें डायरेक्टर ऑफ फार्मास्यूटिकल सर्विसेज is important. He is taking care of entire department of pharmaceutical services. After that, if he is having um, extra burden or extra work, then he will uh, appoint, or PTC will appoint, management will appoint some pharmacy managers. They report to the director of pharmaceutical services. That is depends upon the department size. Or and third level of management is supervisor. Next is, this is a Organizational chart of Pharmaceutical Services Department. Please write down this chart. First is director, then financial management, residency program, new services department, inter-department affairs, assistant director, supervisor, ambulatory pharmacy in left hand side, ambulatory pharmacy and ambulatory clinical pharmacy. After that, drug use for evaluation, supervisor of purchasing and manufacturing services. In right hand side, you can see the assistant director, supervisor and supervisor again. In that, the specialty clinical services, it again having assistant director and supervisor, general clinical services. After that, computer services, supervisor and admixtures services. And in extreme right, the unit dose services also is there, quality assurance and productivity monitoring. आशीष,
यस सर।
आप लोगों ने लिख लिया बेटा? लिख रहे हैं आप लोग?
यस सर, लिख रहे हैं, बस बचा था थोड़ा।
हाँ, आप लोग उतार लीजिए, ये इंपॉर्टेंट है। ये ऑर्गेनाइजेशन चार्ट आता है एग्जाम में, तो आप लोगों को ड्रॉ करना पड़ेगा।
यस।
आप में से कोई लैपटॉप पे है तो आप स्क्रीनशॉट भी ले लेना, ठीक है
सर स्क्रीनशॉट ले लिया सर।
हाँ, या अटेंडेंस वाला स्क्रीनशॉट ले लीजिए, जिसमें सब बच्चों के नाम दिखते हैं, वो अटेंडेंस वाला शॉट ले लीजिए, ठीक है? फिर अपने ग्रुप में शेयर कर देना। आगे बढ़े हम लोग।
यस सर।
This is another organization chart. Director, financial management, new service department, supervision or assistant director, unit dose services, clinical services, and drug use evaluation use for evaluation and formulary management. And in purchasing, inter-department affairs, quality assurance and productivity monitoring, supervisor or assistant director, again, that is admixture services, specialty clinic services and ambulatory clinic pharmacy. Write down this chart also. Now, personnel in a department of pharmaceutical services, persons, they are working in a pharmaceutical services, professional pharmacist, general pharmacist, clinical pharmacist, specialist and resident. The technical pharmacy technician and support, IT, secretaries or buyers, clerks, etc. They maintain the records or they help in a maintain the data entry. Now this is scope of pharmaceutical services provided in an institution. Just write down headings. The pharma services offered in a hospital may be categorized as product services, clinical, teaching, research, other support services. They may be further differentiated as hospitalized patient and ambulatory patients. The product services for hospitalized patient. We are talking about here inpatient who is hospitalized or present in a hospital ward or admitted in a ward. The preparation and provision of all drugs, intravenous solution should be in unit use, appropriately labeled, delivered to the patient care area in timely fashion via UD and IV distribution system. UD unit dosed or intravenous or distribution system, that all delivered part or delivering to the patient is handled by the nursing staff. Pharmacists, they are responsible to issue the medicine or drugs to the ward pharmacy or to the nursing staff, and they take care to the administration of drug to the patient, inpatient. That is nursing staff is directly involved in the this administration of drug area. This advantage of UD and ID distribution system that minimize the prescribing error. How is this minimized? Because the prescription is with them only, and as per the prescription they are giving the drug. Patient is not taking medicine its own. He is depends on the nursing staff or pharmacist. He directly they serve the medicine to the patient time to time. So prescribing error or some technical error or human error from the patient side is minimized. Minimize the preparation and administration error, minimize the waste, minimize drug inventories, minimize drug cost may be provided from central pharmacy or satellite pharmacy. Satellite pharmacy is a new term for you people. Central pharmacy is a main pharmacy or this is a centrally located pharmacy department in an entire hospital. From there they keeps or they made some satellite pharmacy in a floor wise or in a department wise in a particular area and ward wise, and from that satellite pharmacy that nursing staff or pharmacists take the medicine and administer to the particular patient, inpatient. This mobile drug card or combination thereof. Mobile drug card means they are having some they are keeping the some important and regular medicine in that, and they are keeping in a floor, and that also from medicine can take from there also nursing staff, they take the medicine from mobile drug cart also. Procedure for the UD distribution system: the pharmacist first review direct copy of physician order, that whatever prescription written by the physician, they handled by the pharmacist, and he review that prescription and evaluate the order of appropriateness of the drug for the disease, dose, route of administration, and frequency. He also reviewed the patient's drug profile for the drug interaction, therapeutic duplication, and drug allergy. Then drug is prepared and dispensed in 24-hour supply, with each dose individually labeled with the drug name and dose. That is all done by the pharmacist. To review the prescription of pharmacist, after that evaluate the order, review the patient drug profile, and all checking the all drug interaction, duplication, and drug allergy. Then it prepare or dispense the dose of that particular patient. Pharmacy counter system are used to extensively in the provision of inpatient pharmacy services. More hospital pharmacy and beginning to use the automated drug preparation and distribution system. Now, product service for ambulatory patient. Just write down this thing. The product services for the ambulatory patient. Ambulatory pharmacy serves the medication need of discharged patient, patients seen in a hospital, clinics, emergency rooms, physician office buildings, hospital employees. Patient education and counseling is provided in this area also, because here is patient is not with you, he will take medicine and go to the home. In that condition, you have to give the proper education or counseling to him. Patient drug profile is maintained. It differ from the community pharmacy in extensive clinical services provided, often prepare and provide we have only few minutes. Provide drugs that are not available outside. Now, clinical services for hospitalized patient. You just write down the point. This thing is important, and directly they will ask the question from the pharmaceutical services, clinical services, hospital pharmacy, and hospital, organization of hospital. Like that, they likely ask the question. To ensure that drug therapy is appropriate and cost effective, this service can be provided by the pharmacist who also provided product service, pharmacists who specialize in the provision of these direct patient care services. The minimally clinical pharmacy includes formulary system management. Uh, Earlier, I told you formulary system is a some drug formulary is made up by the hospital, that is made up by the to receive the advisory of PTC. When PTC recommend the drug formulary, that the hospital prepared the drug formulary, and he drug formulary is nothing but a list of drug which is always present in a hospital for the use of patient commonly used drug, life-saving drugs included in this list formulary. Now, drug uses and evaluation due, that is called. Drug which is used for evaluation, maintenance of patient drug profile. Patient drug profile maintenance also is very important key of the hospital, and it is also maintained by the pharmacist. The review of every drug order for therapeutic appropriateness. These are comes under the clinical services. Decentralized clinical pharmacists may provide clinical services for a geographic area of the hospital, a specific medical or surgical services, all the patient hospital wide on the particular therapy. Means here we can say the uh, hospital is divided into a several wards. Burn ward is different, children's ward is different, and women's, gents ward, private rooms, all are different. Then all locations we have to appoint different or decentralized clinical pharmacists. That is, they are going to say in this slide. It include medication, histories, provision of drug information, consultation in the selection and changes of drug therapy, therapeutic drug monitoring, that is very important. Therapeutic drug monitoring, they ask simple 4 marks question in therapeutic drug monitoring, that is also maintained by the pharmacist. The selection of most appropriate drug delivery devices, accompanying the medical team on round, means you have to uh, go for the round in a ward or in a private room or in a general ward with the medical staff and nursing staff. That is also your duty, pharmacist duty. Discharge and consultation, that is also a part of pharmacist. Department of Pharmaceutical Services may provide various specialty clinical pharmacy services focus on patient receiving extremely extensive and complex drug therapy. This is critical care, nutritional support, infectious disease, transplantation services. Here also a important role of clinical pharmacist. Now, other clinical specialists may provide drug information services through a formal center, manage a pharmacokinetic consultation services, drug use evaluation services. These are the other services which is provided by the clinical pharmacist. Now, clinical services for ambulatory patient. Ambulatory patient clinical pharmacists in a hospital are become increasing involved in the selection and monitoring of drug therapy for the patient seen in a hospital, patient counseling, maintenance of patient drug profile, drug interaction monitoring, a dramatic improvement in a disease state when pharmacists and integrally involved the compliance, the enhancement. If we are giving or we are monitoring all those things, patient counseling, maintenance the patient drug profile, drug interaction monitoring, all these aspect we are considering, then we will give the or we will see the good effect of medicine or uh, improvement in a patient health. These also include refill clinics, medication monitoring clinics, pharmacy directed primary care clinic, pharmacy directed specialty clinic, and also home therapy. That is also based on product and clinical basis. Important area of the pharmaceutical services is teaching and research. I earlier told you entire throughout a year number of teaching or training program is going on within a hospital for the budding pharmacist or the new pharmacist or new nursing staff or technical staff. Uh, the teaching activity includes in service education to the pharmacy staff and other professionals, teaching sites of pharmacy for pharmacy student, some D-Pharm student, diploma pharmacy student, they are also taking a training within a hospital, that is a 3-month training or 540 hours training that include in a curriculum of diploma pharmacy within a hospital. Postgraduate education training and accredited residencies. Research program include the management of investigation of drug studies, evaluation of drugs, evaluation of new drugs therapies, and new type of services, quality and cost care. These are outcomes study of ambulatory services, pharmacy fellowship to teach research skill. These are comes under the heading of research program include in pharmacy services. Now support services. These services we will take in next class. Now our class time is over. We have less than 1 minute. If you have any question, this is a very descriptive and uh, theoretical subject. You have to prepare a proper notes, and after that